An unimaginable scene that's really quite tough to even fathom. Bodies being loaded into an 18-wheeler in Brooklyn, New York. The man recording the shaky video, his voice quivering.
Please stay inside. Please pray for the people.
As new grim estimates put the potential death toll when all is said and done as high as 200,000 in our country alone. More than 500 dead in America in just the last 24 hours. Much of the focus on this coronavirus emergency is now on the epicenter here in New York. A field hospital has been set up in Central Park. A Navy hospital ship has now moved in. This weekend, the president extending federal guidelines urging all Americans to stay at home until the end of April. But across the country, the response is fragmented. States ordering restrictions on residents from other states coming in. States competing with others for critical resources. The New York governor lashing out today.
There are no red states and there are no blue states and there are no red casualties and there are no blue casualties. It's red, white, and blue. This virus doesn't discriminate. It attacks everyone. And it attacks everywhere.
Typically, Americans come together in times of crisis, but are we doing the same in this moment? Good evening, everyone. I'm Lindsay Davis. Thanks so much for streaming with us. As we draw closer to the end of another month that we will never forget, we start the show with this image. This is a graph of the coronavirus cases at the beginning of the month, and with 1 day left in this month, this is where we are now. Almost half of the cases are here in New York. This region is reeling as the death toll continues to spike. Some states like Florida, as you can see in this drone footage, are now putting up checkpoints, singling out New Yorkers and travelers from Louisiana, New Jersey, and Connecticut, instructing them to isolate for 14 days. But what is happening in these regions, experts warn, will happen in most of the country if people do not stay at home. And that's why we begin tonight with the story of one town in rural Georgia dealing with the same challenges those of us here in New York now know all too well.
This isn't the big city. This is small-town Georgia with few stoplights and even fewer hospitals. And they, too, are struggling with the coronavirus. The health crisis is here. And so far, 27 people have died in these small rural communities since the outbreak began late last month.
It just shows you, you're not safe in rural America, small urban. This isn't just for the big cities. It's for all of the United States. And we need to be vigilant in what we're doing to eradicate it.
The Phoebe Hospital System serves a number of rural counties in southwest Georgia, and the campus in Americus is the home hospital for President Jimmy Carter, who lives in nearby Plains. Nearly 500 people here have tested positive for the coronavirus, and they're still waiting on test results for another 1,000 or so patients. The Georgia National Guard has sent doctors and nurses to help. All of the beds in the ICUs are full.
We have had some transfers, and you can imagine there's not a lot of hospitals willing to accept or wanting to accept a positive COVID patient.
28-year-old Terica Parks is one of the many who got sick.
I was at home, and my symptoms began to get worse. I continued to vomiting blood. My fever, I was in a fetal position in the middle of my bed because I was in excruciating pain. And so I was crying, like just crying and like, I mean, it was terrible.
Health authorities have traced the outbreak to a funeral on March 7th and another on February 29th. Both were attended by families from 3 different houses of worship. Terica Parks went to Sunday service at one of the churches.
I was at the church on the 10th, and on the 14th, I started to feel weird. I thought maybe I had like a stomach bug.
By the time she got to the hospital, she had a fever greater than 102.
They explained to me they had a short time frame to get this medication in before my organs started to shut down.
Carly Rise is a nurse here.
Yesterday, I had to FaceTime a family member so they could say goodbye to their mom, their aunt, their grandma. And it is so hard. They had to bring a phone up here because we're not allowed any visitors. And I had to go in the room and call them and FaceTime them from the room and show them their family member. It's hard to hear someone else cry over their family, because you start thinking about your family if this was you and all that.
For the medical staff, it's overwhelming, and not just at the hospital.
I am taking this video because I think people need to see what's happening.
Dr. Enrique Lopez is living out of his garage because he doesn't feel safe living inside his home with his family.
If you were going to show me this video several weeks ago and told me that this would be where I'm living, I would have never believed you. Several weeks ago, we had heard about a virus that came from a place far away from here. And I didn't think much of it because we are the United States of America. We are the most powerful country in history, and we have more of everything than we need. We were wrong. We were wrong in an epic way.
In one rural county here, more people have died from COVID-19 than in any other county in the state, including the state's largest counties in and around Atlanta. The concern and fear are so great, more than 900 people who felt sick and crowded the hospitals have tested negative for the coronavirus. Georgia's governor has stopped short of ordering a statewide lockdown and is one of the few remaining governors to do so. City and county governments here have issued those orders instead.
We are getting some reports. Most of our businesses are in compliance, and I know that there's nothing insidious about this, but convenience stores particularly, we have to minimize the number of people who are inside the stores.
Like many here, Terica Parks is now on the mend.
Hey you guys, as you can see, I am finally free again. I am out of quarantine. I'm actually outside in my backyard. I still have not hugged my kids yet. It has been since the 14th, but it feels like it's been forever. So I'm excited. I'm getting ready to hug my kids.
She reunited with her family on Saturday. Theirs was the sound of joy that's been missing here since this outbreak began. They warn everyone to do whatever is necessary to prevent this virus from hitting home. Steve Osunsami, ABC News, Atlanta.
Love seeing that hug, and our thanks to Steve Osunsami for that report. And here in New York City, some of the most iconic sites juxtaposed with haunting images. The so-called crossroads of the world, Times Square, a virtual ghost town, a section of New York's famous Central Park now populated with makeshift medical tents. ABC's chief national affairs correspondent Tom Llamas takes us inside the city's crisis centers, which sadly may soon be replicated in other parts of the country.
Please stay inside. Please pray for the people.
Tonight, the governor of New York says the situation is painfully clear, and these images show it. A body loaded into a refrigerated truck outside this Brooklyn hospital. The city bracing for a mounting death toll, more than 1,200 lives lost.
We've lost over 1,000 New Yorkers. To me, we're beyond staggering already. We've reached staggering.
Help sailing in today. The Naval Hospital ship the Comfort pulling into New York Harbor, the 1,000-bed facility ready to take on extra non-COVID-19 patients. In the heart of Manhattan, a new field hospital specifically built for COVID-19 patients.
We've done this in war zones and earthquake zones and things like that, so we know how to do this. We've never done it in some place like this before.
The group Samaritan's Purse building it in just days.
Starting tomorrow, this is going to be a working intensive care unit in the middle of Central Park, complete with hospital beds, ventilators, overhead lighting, even a negative pressure tube sucking all that contaminated air out, making sure the room is sterilized.
As New York is pushed to the brink, health experts warn the potential U.S. death toll could soar as high as 100,000 to 200,000 people.
I think it's entirely conceivable that if we do not mitigate to the extent that we're trying to do, that you could reach that number.
The president forced to reverse an earlier proposed plan to reopen the country by Easter, now extending social distancing guidelines to April 30th. Dr. Anthony Fauci saying the task force argued strongly with the president to extend them, and the president listened.
Challenging times are ahead for the next 30 days, and this is a very vital 30 days. We're sort of putting it all on the line this 30 days.
Tonight, we're learning one of the latest victims is pediatric neurosurgeon Dr. James Goodrich from New York's Montefiore Medical Center. The world-renowned doctor making medical history when he successfully separated conjoined twin boys during a 27-hour surgery. Doctors across the country struggling to help families unable to visit their loved ones in the ICU.
We make it a point to call families twice a day, but I can't imagine being that person on the other end, having to wait for that phone call, never knowing what sort of news you're going to get.
An emotional toll also on nurses who are so often the critical link between patient and family.
I just came from a patient's room. He's actively dying, positive diagnosis of COVID-19, and his family can't come, so I had to FaceTime his family, and it was just so heartbreaking.
In New Jersey, 8 patients dying at a single nursing home. And 911 call centers stretched thin as well. In New York, a record 6,000 calls in one day. First responders also hit hard. About 5,000 members of the NYPD are out sick. More than 900 officers and 260 firefighters testing positive. And now in New York City, a $500 fine for anyone ignoring social distancing rules.
The police and all our agencies are authorized to use fines. We've given enough warning.
Tougher penalties in Maryland as well, where cases surged 400% in just the last week. 66 residents infected at one nursing home. The governor ordering residents to stay at home or risk up to a $5,000 fine or jail time.
This region is about to be hit with the virus in the same way that some other major metropolitan areas have been.
In Louisiana, officials say they need 14,000 ventilators and fear they could run out next week.
If the metros and the rural areas don't take care now, by the time you see it, it has penetrated your community pretty significantly.
Cases spiking in cities like Chicago and Detroit. This convention center in the Motor City is going to be turned into a 900-bed hospital. And in Philadelphia, this arena at Temple University transformed into an overflow hospital after cases in that city topped more than 1,000. And tonight in Los Angeles, the Naval Hospital, the Mercy, already taking on extra patients to ease pressure on so many hospitals.
And Tom Yamas joins us now. Tom, just devastating stories. Curious, though, as you report on the human toll, what strikes you the most about this crisis?
You know, Lindsay, I still hear from friends in other parts of the country, and they ask me, is it really as bad as it looks on TV? And I'm always shocked by that question because I tell them it's actually worse. And it's not to scare them, it's not to panic people, but we can't be in every hospital. But we're hearing from so many doctors, and they're telling us it's really bad. And then I always tell people the stat that I've been repeating, you know, over the past couple of days, on average, every 6 minutes, someone in New York is dying of COVID-19. When you hear that, it stops you in your tracks and lets you know just how significant and serious this issue is. We have a massive naval hospital ship now on the west side of Manhattan, in the middle of Central Park. We have a field hospital that was built in days by that Christian group. They're going to start seeing COVID-19 patients tomorrow. It gives you a sense of how real and how urgent this is. And Governor Andrew Cuomo said it today. It's happening here in New York. Tomorrow it's going to happen in your community.
Right, Lindsay? Just every 6 minutes. That is just staggering to hear that number. Our thanks to you, Tom Yamas. The warnings are clear. No community should expect to go untouched by this. As Tom just reported, the crisis keeps intensifying. And meanwhile, there's an ongoing issue in several states. Some churches are defying orders and carrying on with church service as usual. In Florida, a megachurch pastor was criminally charged after holding a Sunday service. In Louisiana, neighbors of another church were outraged by the crowd there. That's because that state is dealing with a looming crisis, something they have not confronted since Hurricane Katrina. Our Marcus Moore is in New Orleans.
Tonight, for the first time since Hurricane Katrina, the New Orleans Convention Center transformed to deal with an unfolding catastrophe. And a usually vibrant city is bracing. This is the historic French Quarter tonight. It is shut down, and health officials fear that Mardi Gras, that brought thousands of people right here to Bourbon Street, may have helped to spread this highly contagious virus. Over the weekend, cases of COVID-19 in Louisiana soaring from roughly 2,700 on Friday to just over 4,000 today.
We still have an awful lot of work to do to try to
flatten the curve.
But that didn't stop hundreds from flocking to Sunday services at Life Tabernacle Church outside Baton Rouge.
They were all spread out, probably 1,200 or so.
Some of the church's neighbors outraged.
We have a right too, man. Y'all need to shut that church down.
In Tampa, one megachurch pastor also defying stay-at-home orders.
People are going totally crazy. As the president said, he wants to get everybody back worshiping God come Easter Sunday. That needs to happen.
But hours later, the president changed his tune, and tonight, that pastor under arrest.
His reckless disregard for human life put hundreds of people in his congregation at risk, and thousands of residents who may interact with them this week in danger.
We are joined now live by Marcus Moore. Marcus, this seems like a landmine. Government officials telling church leaders they cannot hold services. What about religious freedom?
Well, you know, it's a very sensitive topic, Lindsay, and many legal experts will argue that religious freedom is a constitutional right, but not something that is absolute. So it can be trumped by a public health emergency. But you cannot help but realize the fact that this is an unprecedented time for so many people, and they want to lean onto something that they are familiar with, their faith, and for many of them, their church family. And that's what we have seen here in Louisiana this weekend. But I should point out that other churches that have continued to gather together, they've done that virtually using live streaming on the internet to hold church services without putting so many people in such a close space.
Yeah, really a gray line with that separation of church and state. And also, Marcus, what are you hearing officials say about the state of Louisiana being prepared to deal with this crisis?
Well, Lindsay, they are preparing. They are right now, as you heard in that piece, preparing the convention center with 1,000 beds. They are also really reminding people and urging them to stay home, because even this weekend there were gatherings, including a second line that police broke up. And the governor has said that anyone who is ignoring the stay-at-home order that's in place here in Louisiana right now, that is grossly irresponsible. And then those that do, they are taking precious time away from first responders and almost making it more likely that this virus will spread.
All right, Marcus Moore, thank you very much for that report, Marcus. Now to the latest on the group of passengers stranded at sea. Their coronavirus-infected cruise ship is trying to dock after 4 people have died and many on board are reporting flu-like symptoms. The ship has been turned away by other countries, and leaders here in the U.S. are also calling for the ship to find another place to dock. ABC's Victor Kendo is in Florida and joins us now with the latest. Victor?
And Lindsay, Florida's governor has made it clear he does not want any more sick people coming into the state, and many of the officials in Broward County would agree. They're actually holding an emergency meeting tomorrow morning to decide whether or not they're going to allow those ships to dock at Port Everglades in Fort Lauderdale. Now, here's the latest with those ships. Holland America says their 2 ships have made it through the Panama Canal and could be here in just a few days. They have transferred passengers who are not showing any symptoms from the Zaandam to the Rotterdam. Guests on both ships will be confined to their rooms throughout their journey. Nearly 200 passengers are sick. 2 have tested positive for COVID-19. 4 have already died, including 1 American. There are simply not enough tests for everyone. Florida's governor says, we think it's a mistake to be putting people in southern Florida right now, given what we're dealing with. So we would like to have medical personnel simply dispatched to that ship, and the cruise lines can hopefully arrange for that. Tend to folks who may need that medical attention. Governor Ron DeSantis also monitoring the roadways over the weekend. He ordered checkpoints on I-95 along Florida's northern border to screen travelers for COVID-19 hotspots, possibly coming in from New York and even Louisiana, where Marcus just reported we're seeing a spike in cases there. And those new travel restrictions follow a similar order we saw last week, where visitors coming in from New York, New Jersey, and Connecticut are being told to quarantine for 14 days under the threat of 60 days in jail. Lindsay?
So, Victor, there are some strict rules in place, but why is there no statewide shelter-in-place order for Florida?
Well, Lindsay, the governor has been kind of hesitant to issue any kind of statewide order here, basically coming down to the fact that he believes that some of the more rural areas in the state don't need a shelter in place here. Different story, though, in southeast Florida, where we are, where about 60% of the positive COVID cases are found. Now, we're talking about Palm Beach County down to Broward, Miami-Dade, and Monroe, where the Florida Keys can be found. Just today, he issued a new order, basically a shelter in place, and he's telling Floridians that we could be in this through mid-May.
It was only a couple of weeks ago, of course, that we saw those crowded beaches. Since that time, have you gotten a sense that people are starting to finally take things a little more seriously there in the Sunshine State?
Absolutely, Lindsay. And right here on Miami Beach, this park right behind me, it would normally be packed on a beautiful night like this. Same with the beaches, but those have been closed down here. Different story in some parts of the state, just south of Jacksonville, one of the beaches there. It got a little busy over the weekend, and officials were quick to shut it down because people were not following social distancing guidelines. But for the most part, I can tell you, at least where I am here, southeast part of the state, people are definitely obeying the rules. One piece of good news here, Lindsay, City of Miami Mayor Francis Suarez, he tested positive for COVID-19 a few weeks ago. He just posted on social media that he has now tested negative twice. He is very eager to hug his family. Lindsay?
I bet indeed. Some good news there, and also that people are abiding and not right behind you in an empty live shot. So we appreciate that report. Victor Akendo, thank you. And when we come back on this National Doctors Day, the healthcare providers on the front lines and their dire warnings. Terrified doctors and nurses still saying they don't have enough protective gear, and now reports of medicine shortages. The crisis overseas, the death toll still mounting in Italy and Spain, but there is a bit of a relief in some of the numbers coming in there. And later in the show, how some of the challenges President Trump has faced in the Oval Office may be instructing his moves during this crisis. But first, our myth bust of the day. Does drinking alcohol treat coronavirus?
So this here is the waiting room at Mount Sinai Beth Israel. It's Saturday afternoon, just after noon, a little after 12 o'clock, and you can see that the waiting room is totally empty. I think one of the things that really scares me about this disease is that we're not seeing a lot of low acuity patients. People are really, it seems like they're afraid to come to the hospital. Normally at this time of the day, we try to keep the waiting room as empty as possible. We want to make sure that patients can get seen and evaluated by a doctor, so we try not to use the waiting room, but it's pretty uncommon to see it completely empty like it is right now. It really just speaks to the anxiety that we're seeing in the community, that people are afraid to come to the hospital right now.
Yeah, just an eerie scene right there. And as you just saw, doctors and nurses continue to fight on the front lines of this crisis. That doctor talking about the changes that he has seen in one section of the hospital, while in other sections of that New York City hospital, the battle against COVID-19 rages on. These brave medical professionals are working around the clock and in many cases face dramatic shortages of masks and other protective gear. ABC's chief national correspondent Matt Gutman has a look inside the kinds of conditions that they're facing.
Tonight, the virus attacking frontline doctors and nurses. Miami ICU nurse Araceli Buendia Illegan, who treated thousands of patients over 3 decades, on Friday dying with alarming speed. She'd mentored her niece Joanna, also an ICU nurse, in England.
How do you feel going back to work? What does that make you think about?
Well, to be honest, I'm terrified for my life, because especially what happened to my aunt.
Dr. Arnold Weg believes he contracted the virus when a patient coughed on him.
My father is truly in the fight for his life.
Weg is a 63-year-old grandfather of 6 and a marathon runner. He's now in intensive care for the first time as a patient.
Yesterday was my parents' 38th wedding anniversary, and this is the first time they couldn't spend it together.
Hospitals now reporting drastic shortages of masks and protective gear. Doctors telling us they have a single mask assigned for an entire week. A national survey found 88% of cities do not have adequate supply of PPE.
I have nurses that call me on a daily basis
to tell me that they're scared, to tell me they don't know what to do. We didn't sign up for this.
Mary McDonald recorded this video saying it's not just supplies, it's basic medication.
We're out of Tylenol. We're out of Tylenol. I don't know what I can do to save people anymore.
Tonight, California officials warning they're on the verge of a massive spike. The state has at least 5,700 cases and rising.
When the mayor says that he's seeing a surge in Los Angeles, where is that?
It's all over. So what's probably most concerning is the number of COVID-19 patients who need ICU admission doubled over the weekend.
But testing is slow. On average, it's taking 7 days to get results.
We have currently over 60,000 tests waiting for results.
One doctor on the front lines facing a cruel twist of fate. This moving image showing Arkansas medical resident Jared Burke's social distancing from his own 1-year-old son, Zeke. And then on Saturday, an EF3 tornado destroying his family's home.
It felt like the house lifted up and then slammed back down. I was saying, God, I'm not ready to die yet. And luckily, I guess he heard me because I'm still here.
And north of Seattle, the latest example of how infectious the virus can be. A choir meeting on March 10th for a rehearsal after the outbreak had started. They tried to practice social distancing and used hand sanitizer, but tonight, 45 of the 60 who attended are infected. At least 2 have died.
And Matt Gutman now joins us live with more. First thing that struck me was that they said they're out of Tylenol. But let's talk about testing here. The California governor told you that they are the wait for results. I think he said 60,000 tests. People are still waiting to get results. He called it alarming. So what's the state doing to try to change that?
Well, let's just get to that alarming part. That means that there are probably thousands of patients out there who are COVID positive who might be out in the public still. They are trying to get testing in more cities, but the problem is there is no centralized testing regime in the whole state. So it's county by county. To give you an example, LA had 0 testing by the county over the past week. Now it's up to 2,000 a day. They hope to get up to 10,000 a day next week. But again, the issue is that lag time right now taking 7 to 12 days. They need to get it down to 24 hours to 48 hours for it to actually make a difference, Lindsay.
All right, Matt Gutman, our thanks to you. And we still have much more to report out tonight. The severe weather outbreak, the harrowing images coming in, the threat, sadly, is not over. And our closer look at the different approaches that some states are taking amidst this crisis. But first, our tweet of the day, what the police in D.C. are playing while they tell people to stay inside their homes. Much of the U.S. is obviously gripped with the impact of COVID-19, with more than 159,000 cases nationwide. So let's take a look by the numbers at just how states are responding. As of tonight, at least 38 states plus Washington, D.C. have announced the closure of all non-essential businesses, with cases multiplying by 4 times in the past week in the Washington metro area. Maryland and Virginia's governors have announced stay-at-home orders today for their states, but there are still 13 states that have not issued a full statewide stay-at-home order. That includes Florida, Texas, and Georgia, which are now seeing cases of COVID-19 double every 3 to 4 days as experts fear that they could become the next hotspots. Florida now has at least 5,700 cases with at least 71 deaths, some fueled by the spring break beachgoers who appear to ignore concerns about COVID-19. Yesterday, the governor of Texas expanded an executive order requiring 14-day self-isolation for out-of-state travelers, including from hard-hit New Orleans right next door. But with no statewide order, at least 18 counties in Texas have acted on their own, with cities like Houston and Dallas issuing stay-at-home orders. And today, the Navy announced that a 200-person Navy medical unit will head to Dallas to assist medical efforts there. Only 2 states so far have reported no deaths at all from COVID-19, Wyoming and Hawaii. And we still have much more ahead tonight on ABC News Prime. A front row at the Trump show. Next, our own John Carl talks with us about his new book and what may surprise you about the man he's been covering for decades. And dating advice during the coronavirus pandemic. James Longman has that and much more in our Good News Roundup. But first, here's a look at the trending stories on abcnews.com.